history of 22 weeks history of amenorrhea. I'm the senior house officer. My task is to do a bimanual examination. That's my task. Hello examiner, this is my reference number. Can I please proceed?
Yes.
Thank you. In a real patient, I'll first of all greet my patient. I'll check the identity of my patient. I will introduce myself. I'll tell the patient that the purpose of my visit is to examine her front passage with the help of 2 gloved, lubricated fingers. For that, I'll ask my patient first of all to empty her bladder. I'll ask her to undress below the waist. I'll provide her with privacy and request for a chaperone. I'll ask her to lie down on the couch with her back on the couch and her hips and knees bent, thighs apart and ankles together. Can I please have a pair of gloves?
Yes, you can.
Thank you. Can I please have some gel? Thank you. Right. On inspection of the lower abdomen, I cannot appreciate any abnormal swellings, cannot appreciate any scars. There are no abnormal hair distribution, cannot appreciate any other abnormality on the lower abdomen. Cannot appreciate any discharge, redness, scars, sinuses or any swellings. I'll warn my patient I'll be touching her. Cannot appreciate any abnormality in the labia minora, labia majora or the clitoris. I warn my patient that I'll be pressing a bit. Cannot appreciate any enlarged Bartholin glands or any Bartholin cysts at 5, 7 o'clock position. I'll warn my patient that I'll be introducing my fingers now. I can appreciate normal vaginal rugosities. I can appreciate the external cervical os. It is circular in shape, it is circular, it is firm in consistency and is closed. The cervix is directed downwards and backwards. I can appreciate the left lateral fornix is free and there is no mass palpable. I can appreciate the right lateral fornix, it is also free and there is no mass palpable. I can appreciate the posterior fornix is also free and there is no mass palpable. I cannot appreciate any fluid in the pouch of Douglas. Through the anterior fornix, I can appreciate a structure midway between the umbilicus and the symphysis pubis. It is soft in consistency. It is mobile. Most probably it is the uterus. It's corresponding to 18 to 20 weeks of gestation. It is anteverted and anteflexed. I'll warn my patient I'll be removing my fingers. Before that, I'll do a cervical excitation test and look at my patient's face for any tenderness. I'll ask my patient to strain to check for any vaginal prolapse or any incontinence. Cannot appreciate any discharge or any bleeding. I'll look for any discharge or any bleeding. I'll throw this in a clinical waste bin. I will thank my patient. I will give her wipes and ask her to dress up. All right, thank you. That's all. My diagnosis can be a gravid uterus, which is corresponding to 18 to 16 weeks. Other differentials can be fibroids, adenomyosis, carcinoma of the uterus, or endometriosis. Right. Thank you. That's all.